Hello everyone. So today we are going to discuss about shoulder joint and some important ligaments around it. So let's start. Our shoulder joint is composed of humerus, head of humerus, and glenoid cavity of scapula, and we call it glenohumeral joint. Why? Because humeral part, head of humerus is involved, and glenoid fossa, glenoid cavity of scapula is involved. So together collectively we will give the joint's name glenohumeral, because glenoid cavity of scapula and humeral head of humerus is involved. So the joint's name is glenohumeral joint. Okay, now if we talk about further, so if you look at here, this is humerus, this is acromion process of scapula, this is spine of scapula, this portion, this is your clavicle. And if we look at here on this ligament, this in the below, this below one ligament, not on the top, this one, this ligament, if we talk about this ligament, this is called coracohumeral ligament, and this ligament on the top, this is called coracoacromial ligament, because it is involved, it is running from coracoid process to the humeral part. So this is called coracohumeral and this is called coracoacromial. Now if you look at here, this ligament, this ligament is called conoid ligament, and this ligament is called trapezoid ligament, and collectively this conoid ligament and this trapezoid ligament, they both collectively called coracoclavicular ligament. So coracoclavicular ligament is composed of, we can say, conoid ligament and trapezoid ligament, and actually this coracoclavicular ligament's function is what? It plays an important role in shoulder joints stability. Okay, now if you look at here, this part, this muscle, this is called subscapular muscle. Okay, now if you move here, if you look at here, this is your humerus bone, humerus. So this muscle name is long head of biceps brachii muscle, and you know long head of this biceps brachii muscle is the anterior compartment muscles of your arm. Okay, we will discuss it later in detail. So right now this is the long head of biceps brachii muscle, which is your anterior compartment's muscle of interior of your arm muscle. Okay, now if you look at here, this portion, this one, this is called supraspinous muscle. Why? Because spine of scapula, on the top of spine of scapula, this muscle lies. So that's why we call it supra means up, above, top, superior. That's why supraspinous muscle. And this muscle, this is supraspinous, and this muscle is called infraspinous. So supra, this is spine of scapula, so on the top this is supraspinous, and below this is infraspinous muscle. Okay, now if you talk about here, this portion, this is called subacromial bursa. This is the acromion portion, this is acromion part of scapula. So this sac of tissues is present below the acromion process, so that's why we call it subacromial bursa. Sub means below, downward. So here I would discuss some clinical points related to this bursa. What happens actually, due to if the person overhead lifts, or due to overheading lifting or some repetitive minor traumas, patients, this part gets inflamed, this bursa gets inflamed. Now what happens if this bursa gets inflamed? The condition is called subacromial bursitis. Okay, subacromial bursitis. So now you know the etiology. How we treat it, we give NSAIDs, and through physiotherapy activities, the patient gets fine within 4 to 6 weeks. I mean within 2 months or 6 to 7 weeks, the patient gets fine. So this is a bursa. Actually, if it gets inflamed, what happens, the patient feels severe pain in shoulder joint. So we give some physiotherapy activities. Patient does that physiotherapy activities, and also through NSAIDs we fix this condition, this subacromial bursitis condition. So but subacromial bursitis means what? It is a inflammation of this bursa, this sac-like structure. Okay, I do hope you have gained the knowledge and you have cleared your concepts. Thank you so much.